So the new pathway then, it was designed to speed up diagnostics and integrate all of the services. It'd be too easy just to leave them where they were. Honestly, it really would have been easy just to clip on some consultant clinics and wouldn't have achieved the outcomes. Patients have been involved all the way, and as I say, Jackie and Jimmy will talk about that a bit more. And the outcome of the work was the Knowsley Community CVD service. And I think there we are with Jackie.
Pass the mic. Feel like having a sing-song, don't you? I'm rubbish at karaoke anyway. So the Knowsley model, I'm the head of engagement, and I feel absolutely passionate. If you're going to ask the questions, be prepared to listen to the answers, because when I write that report up, that's got to be reflected in the Commissioner's spec. And I was a Commissioner for 6 years, and I think that helped this process. And it was really important, whilst we knew what wasn't working, what could be better, we really needed to hear it from the people who'd used it. When we go out to engage in Knowsley and Merseyside, we've got very vocal people. You know, it's quite common, we can talk for England, isn't it? But it's really important that we speak to the right people as well. So it's about the general public, the man and the woman who might walk through your door and tell us what their expectations or their fears are. But very importantly, what was it like to come through that door? How difficult was it? What worked well? What was it like being a member of their family? Did you get help to support your loved one? Or other long-arm caring organisations? So we really needed to ask those questions that sometimes are in the too hard box. And where should services be delivered at the right place, at the right time, for the right people? We've done extensive consultation, and Diane talked to you about the plethora of providers, and I went to those providers and said, I need to get access to your patients. I need to talk to people who've walked the walk and been through the wards. But because of data protection, it's a very restricted situation. So my partnership work with the Trust and the community was to say, I will give you all the consultation and engagement material. Would you send this to your patient groups and your patient representatives and anybody who you feel would be willing participants, and they can then call me and register that they'd like to be involved. And by gosh, they came in throngs, and I mean throngs. Lots of people had lots to say. We used a different way to talk to people about their experience. We brought in scenarios, and we brought in some amateur actors to act out people going through a patient pathway, and we stopped them part way through the process to say, right, what was it like then? Let's discuss. We've done some interactive games. We've got a big literacy problem in Knowsley, and indeed in certain parts of Merseyside, where people just don't respond well to the written word. And so we have to do things differently. So sometimes we'll use actors. We used interactive games, things like snakes and ladders, tell us what your pathway's been. We've done things like countdown. Let's look at communications and marketing, and made it fun as well as talking about the too hard stuff. And also we challenged some stereotypical beliefs, really. We had people who might need to go through pathways around rehab, and there could be the woman who was this was a case now, a woman who had 2 young boys. She was a single mum, and she run a flower shop. So she was up really early in the morning. She had really rubbish lunchtime dinners like pasties and sausage rolls and chips. She ran home like the clappers in 3:30 to sort the boys out. She'd probably have a bottle of wine overnight and maybe a takeaway. So her lifestyle really didn't lend itself. Alongside a gentleman who had worked all his life. His wife had a little part-time job. He had a massive stroke, and their lives were turned upside down. And then there was a young man who went to university and overindulged on illicit drugs and ended up on a cardiac care ward. And those discussions were mixed groups of patients, and it was very interesting how people responded. Are we going to get this young man to come into cardiac rehab if he thinks it's just all old people? How are we going to explain to this person who's a carer, you need to let go a bit, and you need to let your husband do things for himself? So it was very interactive, and it was challenging across the community. The focus in terms of tell us your experience, tell us your story, then looked at what can you actually influence here. Tell us about venues, where they are, where you think they should be. Tell us what time we should be opening these different range of providers and service. How can we improve your service experience? What support do you want? What's not there that should be there? And overall, how can we get the messages out to you through marketing and communications channels? Our public in Knowsley are our best human telephones. And they do far more than any leaflets and flyers ever do, because they tell each other if it worked, and if it did, I'm in, brother. You know, that's the kind of feeling. Part and parcel of the engagement was to say, well, this is not where it all ends. This is actually where it all starts. Because your information is going to now feed this commissioning wheel with all of these other partners who are GPs, PVC groups. I don't know what I'm standing by. Something's feeding back on me.
I don't know what...
Okay. And it was then to say to the public and to patients, do you want to take part in the next stage of the procurement process? And in order to do that, that's a big commitment off people. There's a lot of work goes into reading a spec. There's a lot of work in understanding how to appraise a bid. And so part of my work was to support patients in coming up with strong patient experience questions and then scoring those parts of that bid. And they'd done that as a group. And by God, there was a bum fight on, Jimmy, wasn't it? People were not agreeing on the scores. It was a bit of a scary moment. However, we got there and we had some fantastically interesting variances. The public then agreed who would be their representative on the panel. And each member of that public group had to give a significant commitment of time. So if you're going to go down this route, be in it for the long haul and you need to support people. I think joining forces with that wider clinical group was about equality. We're all here on an equal footing. Drop the jargon. Let's not use clinical language when we're talking to people with non-clinical backgrounds. Understand each other's language. They agreed over all the joint scores and sat on the tender panel and agreed at the final provider. Now, before I go into what's in place now, this is where we're going to shift it over to give you a patient's perspective of one, Jimmy's a community CVD champion and a fantastic ambassador for public involvement. So I'll hand over to Jimmy and then we'll come back to Diane.
Thank you. My name is Jim Jordan. I'm here looking at the patient side of things. Nothing to do with commissioning or what have you. I had a long history of, which finally ended up in me on the operating table, and lots of cardiac condition, lots of heart condition and everything else. And after I'm coming out of that, we needed something to do.